This is Michele Garber, and I'm the host of the NipTuck Talk Show. Today's guest is hair transplant surgeon Dr. Alan Bauman. This is a pre-recorded episode, so please stay tuned. Today we're going to be talking with Dr. Bauman about PRP, which is platelet-rich plasma. So welcome again.
Thanks, Michele. Thanks so much for having me. It's really a pleasure to be on with you again.
Well, thank you. Dr. Alan Bauman is a full-time hair transplant surgeon and medical director of the Bauman Medical Group, located in Boca Raton, Florida. He's an accepted member of the International Alliance of Hair Restoration Surgeons and is also recommended by the American Hair Loss Association. He's been featured as a mass media medical expert in hair loss therapies, and he's been featured in New York Times, Newsweek, Vogue, Oprah Magazine, and more, and has appeared on The Howard Stern Show, Today Show, Good Morning America, Extra, and others. So thank you again. So before the show, we spoke a little bit about some of the reasons for hair loss, and I also mentioned to you that I thought my part was widening a little bit, even though my hairdresser says everything is fine. So if I were to come to you as a patient, what would the consult be like?
That's a great question, because a lot of women don't know really what to do when they do notice that their hair is thinning. So the first thing is to absolutely schedule a consultation with a board-certified hair restoration physician and someone like here in Boca, like myself, or someone locally to you, who can actually do a diagnosis and take measurements of what's going on at the level of the scalp. But the first thing we would do is talk to you, find out about the history of hair loss in your family. Are you on any medications or had recent medical issues that could be contributing to a hair thinning problem? Is this something that happened very suddenly or has developed slowly over time? Did you have hair loss in the past, whether it was from a medication or an illness or childbirth or something that maybe you can remember or relate to? Once we look at the scalp, however, we're looking at a few different things, especially for female patients. You would have to lose 50% of your hair for it to be noticeable to the naked eye. So your subtle hair loss problem may be invisible to even your hairstylist unless they were measuring what was actually going on.
Because I ask her all the time when I go get color, I say that I think my scalp is thinning, and she says, no, it's fine. I would tell you if it were thinning.
We know scientifically there's a way to prove that. How much hair do you need to lose on a normal scalp in order to see more scalp shining through? And the answer to that is 50% of the hair mass. So by the time you've lost 50% of your hair, I mean, obviously that's a lot of hair loss that's occurred. We want to take action. Yeah, we want to take action way before that. And that's where the non-invasive treatments come in. But what we would do is we would typically, if someone like yourself came into the office, we would take some measurements in the back of the scalp where the hair is supposed to be great. Genetically should be permanent or relatively permanent, right in the behind the bone of your skull, back there. That's where the best hair is. That's your teenager hair. And then we would measure in the other areas where you might be seeing some loss. So it could be in the frontal area behind the hairline. Maybe we do some measurements in the crown area, which is where the swirl is in the back of the scalp. We might take a measurement in the temple areas, behind the corner there where your forehead meets the hairline. And those measurements, called hair check, is a cross-sectional bundle measurement that we can go back to again and again, the same area of the scalp, without a tattoo, without cutting any hair, without having to do any trimming of the hair. We can actually get a very scientific measurement of exactly how much hair is growing in these areas. And what women are shocked to sometimes find out is that you may be growing phenomenal hair in the back of your scalp. Maybe you measure 100 there, but in the crown area, you're measuring it at 70. And in the front, you may be measuring at 60. And it still looks pretty good because you still have more than half your hair, but you may have lost 30 to 40% of it already. And you haven't even considered the fact that you have significant hair loss. That's a lot of loss already.
That's very interesting. And this is a great segue into PRP for hair loss. Platelet-rich plasma. Explain a little bit about what platelet-rich plasma is and how this has come about to treat hair loss.
Yeah, so PRP is an exciting technology. It's an exciting modality for many, many, many areas of medicine. And this is not something super new here. I mean, we're talking about something that's at least 10 or 15 years old in the field of orthopedics and other areas of medicine. And what PRP is, platelet-rich plasma, it's a treatment that's derived autologously, and that means from your own body, that will help you repair and rejuvenate different organs or tissues that you have. So, for example, when a physician like an orthopedic surgeon uses PRP, he may be using it to help someone with an injured knee or torn cartilage or something like that. But when it comes to hair, I think the first information that we got about PRP, which again is derived from blood, and I'll explain how that works in a moment, but the most exciting thing that came out first in the field of hair was that it was used as a surgical adjunct, that it was used to improve the results of hair transplant surgery. And what PRP is a blood sample that's then spun in a special device called a centrifuge to separate out its components. So we're separating out the platelets and the plasma from the red blood cells. We don't want to use the red blood cells. We want to use the platelet. The platelets are also responsible for releasing very powerful growth factors, which are molecules, proteins, into that area of wound healing, and they orchestrate tissue repair. And so what we're trying to leverage when we take a blood sample and we spin it to separate out the platelets and the plasma, and this has to be done very carefully, but when we do that, we're leveraging those packets of proteins that are sitting inside the platelets, and we're going to use those proteins to either accelerate the healing from a hair transplant, or to stimulate the follicles directly to produce better quality hair.
How long have you been doing PRP?
So I've been doing PRP, it's probably 6 or 8 years now. Initially, it started with just hair transplant patients. So it's an amazing thing that we can use something that helps out with wound healing to actually stimulate and rejuvenate hair follicles. I had a patient with 4 or 5 different areas of hair loss due to alopecia areata, and she came in. We did a PRP spin. We used extracellular matrix with it, and we could talk about that, why we do that. And we did the injections into those areas with using local anesthetic, completely painless procedure. And she had full and complete recovery of those bald spots within 12 weeks.
Would you explain to our listeners what extracellular matrix is?
Yeah, so when we mix special things with the PRP, we can get a stronger and longer result than having to come back and do PRP like every other month. We can get a year's worth of growth. Extracellular matrix, first of all, is a term that's used to describe stuff that's not in the cells. So you have extracellular matrix all over your body, and the most popular extracellular matrix in the field of hair restoration is called A cell. And now A cell is made from porcine bladder. That means pork bladder. And so it's really good for healing and such.
So the PRP you inject into the scalp, correct? Mm-hmm. Right? And you numb the area.
Correct.
I did read it's a little painful. Is that, have you experienced that with your patients?
What I have experienced is that patients often contact me after they've had a PRP someplace else, and they say, well, my PRP procedure at my dermatologist's office was very, very painful. And the first thing I ask is, well, did he use any local anesthetic? And they usually say no. Or they say, well, they put a little gel on my skin and that was that. Well, that's not what we're doing. So one of the things that I teach and train, and I've trained well over 100 doctors how to do PRP treatments, is we teach them how to perform a painless scalp block so that the patient doesn't feel any of it. PRP doesn't have to be painful. So once we have the scalp block in place, yes, then we would do the injection. And these days, we're not using the A cell. We are using something else called BioD. That's kind of a more advanced extracellular matrix that, in my opinion, in our hands, seems to work a little bit stronger and longer than the other mixtures that we were using.
How many injections is typical?
Well, a lot. But the good news is that you don't feel any of them. So they're very, very tiny. Each injection is actually less than a half of a cc, less than half of a milliliter. So it's a very, very tiny injection. It's a very superficial injection, meaning very, very shallow in the skin. But yes, there's hundreds of them that are performed during a single PRP treatment. But out of the hundreds, you're not going to feel any of them because the scalp is completely numb. When we do our work at Bauman Medical, you're not going to feel anything during a PRP treatment.
Well, that's good.
So if you've had a PRP treatment out there and you think, oh gosh, it only lasted for a month or two, well, it's probably because you didn't have extracellular matrix. And if you had PRP done and you think, oh my gosh, that was the most painful thing, probably the doctor didn't have any training on how to do a scalp block. And if you had PRP and you didn't have a hair measurement before you started, you're not going to know what the benefits of the PRP were come 6 months or 12 months down the road when it's time to decide, should you do another one? So those are some pretty common pitfalls that we see out there in the industry right now.
Is that hair growth, is it permanent? Because I know if you use, let's say, Latisse, and you grow your eyelashes, if you stop using Latisse, then your eyelashes revert back to what they were before you started Latisse. Is this the same with PRP, or is that growth permanent?
Yeah, PRP growth is never permanent, in my opinion. It always will last for a certain period of time. It will improve for a period of time. It will plateau after that, and then it will start to fade. So having done PRP treatments on hundreds and hundreds of patients and track them over time, literally every 90 days, moving on into the future, we know that most patients these days will have that plateau phase last up to about a year or so, and which is good because you'll start to be able to see the results for sure by that time. But then after a year, in many cases, it starts to decline again. Now, not super fast, but usually starts to slowly decline back to where the baseline was. Some patients will last up to 2 years with PRP plus BioD. Other patients may last only 9 months, but that's what the measurements are able to tell us. So the measurements can tell us when is it time to get your next PRP treatment.
I see. So it's like fillers. Combining fillers and Botox and PRP. There you go.
I mean, your fillers are going to last a certain period of time, right? Because your body's going to start to reabsorb it and
right.
such. So it is something you have to continue to do, maintenance-wise. And there may be areas that improve greatly with PRP, and in order to keep those areas looking good, you might need to inject every year. So I always tell my patients that PRP is certainly a commitment for the long term, that you should plan on having these injections at least every year. But if we can stretch it a little bit longer, hey, if your treatment's lasting longer than that, then no worries. We'll delay, we watch, we measure, and we'll see what happens.
How long is a session?
PRP takes about an hour. It's literally like a lunch hour.
Okay.
It's door to door in an hour.
Are you sore afterwards?
Well, the scalp is going to be numb for a couple of hours because we put the block in there, and then the scalp is going to be a little bit pink in the area that we did our work.
Right.
And then over time, the numbness goes away. Some patients do feel a little bit of tingling sensation. They might need to take a Tylenol after the procedure. It'd be pretty unusual. Maybe only like 10%, 15% need a Tylenol or Motrin. But by the next day, you shouldn't feel much of anything. And worst case scenario, you might see a little bit of puffiness in the forehead if you slept forward instead of backwards, or slept on your face instead of your side or something. But there's ways to prevent that as well. We give patients some different tricks to be able to block the swelling if it does occur, especially if we're working in the front of the scalp.
So what are the risks? Are there risks of PRP?
Well, risks of undergoing a PRP treatment without knowing what your hair loss problem is probably the greatest risk. So if you're visiting a physician who is not examining your scalp with a microscope or taking measurements, comparing different areas, or getting a detailed medical history from you, I'm talking about a physician doing this, then you may not be in the right spot to diagnose and treat your hair loss. So that's the first thing. If you've had a treatment that was done without extracellular matrix, like if it was done without ACell or without BioD, and you didn't realize that you're going to have to come back in another month or two for a repeat, or several sessions per year, that's a risk also, because that hits your pocketbook, right? And also your schedule. You have to literally take the time out of your day to do it.
Yeah.
Now, some patients do notice within the first 6 weeks that they might experience a little bit extra shedding during that time, and that's not uncommon when you undergo a hair growth treatment, especially one that's powerful.
One question: how much does this cost?
Yeah, so the PRP cost in our practice is $2,500, and that's with the extracellular matrix. And you have to figure that that's going to be your annual cost moving forward.
So that's one treatment of PRP, $2,500.
Mm-hmm. And typically one zone, meaning that it's sometimes difficult to treat the entire scalp with PRP. Sometimes we're treating scars, patients who have had brow lift scars. We can use PRP to improve the look and the feel of those scars, or even old style hair transplant scars, from the old days when people used to use scalpel and stitches to harvest the hair follicles.
So it could cost as much as $5,000 if you do it in more than one location, right?
Actually, it's not. If you're doing a double dose, we don't actually charge double for that. So there's a little bit of a courtesy. So,
okay.
Each additional area is $1,500.
I want to thank you again, Dr. Bauman, for your time. This has been a very interesting episode, and I hope our listeners, especially those suffering from hair loss, now have a little bit more information about treatments and how to go about seeking out those treatments and the best qualified hair transplant surgeons. So thank you again.
Thanks so much for having me, Michele. Really, it was a great time.
Listeners can reach Dr. Bauman at 561-394-0024. His website is BaumanMedical.com. You have a Facebook page. What is the Facebook URL?
So it's facebook.com/BaumanMedical, BAUMAN.
You're also on Twitter.
Right, at Dr. Alan Bauman, DrAlanBauman.
Listeners can reach Dr. Bauman at 561-394-0024.
Correct.
And Dr. Bauman's website again is BaumanMedical.com. I want to thank our listeners today, and if you have any ideas or suggestions for topics or guests, you can email me at info@niptuckcoach.com. And please be sure to subscribe on iTunes, Stitcher, and iCloud, and follow us on Facebook and Twitter and at deepbody.ca. And remember, you only have one face and one body, so please choose wisely. Thank you for listening.